everybody, it's Cheyenne and welcome back to my channel. Today I'm going to be doing a video on extractions. Woohoo! Now this might sound weird, but extractions are one of my favorite procedures to do. I really enjoy extractions and crown preps. Those are my favorite. Fillings I think can get a little boring. Root canals are easy, but there's just a lot of setup and yeah. But extractions are one of my favorites. I just feel like they're a little bit more exciting. You know, you're trying to get a tooth out and you know, if there's like infection. I think the like abscesses are kind of fun to pop. Oh my God, I probably sound like a weirdo. But anyways, extractions are really fun and I was able to get my hands on some old instruments that my office was gonna get rid of and they said that I could use them for YouTube videos. So I'm really, really excited about that. So I have my awesome little model here. And I was just gonna go over some basic things that as an assistant you might hand your dentist for an extraction, and then also just explain like what really an extraction is. I'm not gonna go into like surgical extractions and things like this. This is gonna be what we would call a simple extraction. So of course, the first thing that you would do is help your doctor get the patient numb. Your doctor will administer the anesthetic and then the patient will feel no pain during an extraction, but they are gonna feel pressure, okay? But at any time, if your patient's feeling pain, your doctor should be giving them some more anesthetic. Now, of course, with that being said, there is a limit on how much anesthetic you can give a patient. So if your patient gets to that point to where your doctor has given them too much anesthetic or they can't give them any more, then you might have to reschedule. The most common things that I think happen to patients that are not getting numb is a lot of times it's women because women don't eat breakfast or they don't eat lunch. And when you don't have anything in your system, your body's gonna metabolize that anesthetic a lot faster. So you need to make sure you eat before dental appointments, especially. Well, you should be eating anyways, but I know we all get busy. I forget to eat lunch all the time, but it will make the anesthetic not metabolize so fast. But anywho, so you wanna get your patient numb. And then the first thing that my dentist starts with, now every dentist is different. Almost every dentist that I've worked with has a different way that they do extractions, but the one that I currently work with, he always starts with the periostal. So it looks like this. It is similar to a bone file, which I actually have a bone file here as well, but a bone file, you see how the periostal is smooth and then the bone file is rough on the end? So bone file, periostal. So my dentist starts with a periostal. Now this is how he tests if the patient is feeling numb. So let's say we are extracting number 14. We'll go with number 14. So he'll grab this and he will just push around the gum tissue like this. And he'll ask the patient, does that hurt? Is that bothering you? He'll go in here, push around the gum tissue. You know, does that hurt? And then as long as the patient says no, that they don't feel anything, then he'll move on. Now, he uses elevators to start. Some dentists use luxators, which luxators are very similar to elevators. And there's different sizes to elevators and luxators. So he'll start with a small elevator. This one is on the larger side. I don't actually have a small one, but it just means that this tip is a little bit smaller. And what he will do with this is he will wedge it in between, you know, the tooth in front and the tooth we're extracting, and he will put pressure on this tooth to kind of loosen it in the socket. He will do something like this. He'll start loosening it. And he'll go behind it and do the same way. Start loosening it, which I might end up extracting this tooth off my model, but that's okay. So loosening it, and then he'll ask me for the larger one. And I'll already have that in my hand ready to hand him just because I know that the way, you know, the steps that he does things. So he'll start with the small, he'll go to large, so then I'll hand him the larger one. He'll do the same thing. He will, you know, try to loosen it in the socket. Because the goal is with this step is you want to be breaking off those ligaments that are attached to the tooth. You want to be loosening the tooth in the socket, getting the gum tissue away from the tooth, just creating that it's loose in the socket. So once he feels that he has done that, he'll ask me for the forceps. Now, there are a ton of different forceps. The most common ones are a 150, which is used for upper teeth extraction. and then a 151 that is used for lower. Those are the two most common extraction instruments. They're all shaped differently and they all have numbers on them. So I will show you this one here. This one's called a 23. Oops, can you guys see that there? It is labeled there. And so all forceps should have a number on them. I think I've only run across 1 or 2 forceps that didn't, but they all should be labeled with a number. And your dentist might have nicknames for these, but they usually just go by the number, especially when you're first starting out assisting, just to help you learn them. So this is a lower forceps. This is used on a lower molar in particular. And it's shaped like this because it is designed to get underneath the crown of the tooth, like almost in the root surface, and kind of hook under the crown so they can wiggle it out a little bit easier. I have a 150 here. So if you can see the difference of the shape, this is an upper, this is a lower, okay? And the dentist is gonna hold the upper like this because he's gonna be grabbing the tooth, you know, upward. And of course the lower one's gonna be lowered like so. But anyways, the 23 is meant, you know, my dentist will use this if a tooth has like a furcation or if it has recession, especially on a molar, because this is designed to get under the crown and it will kind of hook underneath the crown in between the roots just to get a really good grip on it. This is a lower interior. So this is designed to grab these teeth right here, like so. Wiggle those puppies out. I don't have many other ones. So yes, he'll be using the forceps next. So since we're using an upper, we're extracting an upper tooth, I'm gonna give him the 150. Now this is a 150 AS. This one's shaped a little bit different than the one I use in my office, but this is, for pretend, this is what I'm handing him. So when you hand the dentist a forceps, you wanna hand it like this, okay? Because you want him to grab onto, of course, you know, I guess the handle. You don't wanna hand it like this because he's not gonna grab that way. He's gonna grab up here. So hand him the forceps like so. And then what he will do is, since the tooth is already loose, he will grab onto it like this. Okay. And then he will start to wiggle it back and forth, which I think I'm definitely gonna extract this tooth. And there's gonna be lots of noises, there might be cracking, there might be popping. That's completely normal. It's just the tooth loosening out of the socket. So wiggle, wiggle. And now a normal tooth would have roots, but this is a model, so it doesn't. But then it will come out like so. And then if you're an assistant, you'll have a gauze in your hand or whatever you want to, but he'll hand you the instrument kind of like this and you'll take it, you know, put it on your little counter or whatnot. And then there'll be a teeth collection somewhere that you have for a biohazard that you'll dispose of this in. And then the next step that my dentist does is he will ask me for this. Now, I don't remember the name of this. If you remember the name of it, please leave it down in the comments below. I don't. It looks like a giant extraction spoon. It looks like a spoon to me. But he will use this. He puts it into the socket. And just to make sure there's no leftover bones, there's no root in there, he just cleans out the socket so it heals better. And then you're gonna irrigate the socket. So you're gonna have like a larger syringe that's gonna have like chlorhexidine in it, which is a bacterial mouthwash, or sometimes they'll rinse with distilled water. But you'll inject that into here, so you'll get your suction and you'll hand that to the dentist and he'll inject that and you'll put your suction up here to, you know, to suck it out so the patient doesn't swallow it. And it'll just rinse out the blood and everything that might be left over, any infection, things like that. And then you'll grab some gauze, you'll fold it up into a little square, and you wanna make sure you have enough to when the patient bites down, there is pressure into the socket, and they'll bite down on so, which I have paper towels, I can show you guys that. So I'm gonna show you what I mean. I don't have any gauze here, but I do have some paper towels. So you're not gonna fold it up really large, it's gonna be tiny. It's gonna be kind of like this. And you're gonna put this in and you're gonna have the patient bite down on it just to create something to stop the bleeding and to put pressure on that extraction site to help with the bleeding. And that's pretty much it. I mean, there's lots of extraction instruments, but the whole process is fairly easy. You can get into more difficult ones, especially with oral surgery and things like that. There's a lot of things, but this is just a simple extraction, what we would call, you know, if a tooth came out easily. The most important thing during an extraction as an assistant is just using your suction, but you want to stay out of the dentist's way, but just make sure the patient's mouth is not filling up with blood. You want to be handing him the proper instruments, you know, not having him ask for instruments all the time, just kind of learning what he uses. Most dentists, everyone that I've worked with, they're creature of habits. Each procedure they do exactly the same way. Extractions they do exactly the same way. So it's easier to, you know, it's easy to pick up on what they would want next. And then of course, when you clean up your room, you want to make sure that you flush out your lines. You want to make sure you're not leaving blood anywhere. You're cleaning all that up properly. And then yeah, that's extractions. And I really hope you guys enjoyed this video, and I'll see you in the next one. Bye guys.